I'm Dr. Christopher Nielsen, one of the spine surgeons at Toronto Western Hospital. I'd like to introduce you to a new patient experience and education initiative that we are launching to provide you as a patient with information regarding your diagnosis. Please take the next 5 minutes to learn about spinal stenosis. Back Care Canada is a website developed by the Canadian Spine Society that has good patient education resources. Let me use Sonia's story about leg pain brought on by walking. Sonia already has a long history of back pain. Several months ago, she noticed that her legs were starting to hurt as well. The pain, which occurs mainly in her thighs, begins whenever she walks for longer than a few minutes. The farther she goes, the more her legs ache, forcing her to sit down. Within minutes, her leg pain disappears and she can start walking again. But the pain returns and the cycle repeats. After her first bout of back pain, Sonia thought it might be a good idea to start a spin class at a fitness club to help her get into better shape and increase her stamina. Bending forward on the stationary bike made her back ache, but her legs felt fine. My back pain is a nuisance, but it's the leg pain that keeps me from doing the things I want to do. I can't go shopping with my husband without stopping every few minutes to sit and rest. Funny thing is I can walk farther in the supermarket when I have a shopping cart to lean on. When I am not active, my legs feel fine, but as soon as I get going, I'm in trouble again. If your symptoms sound similar to Sonia's, then chances are you're suffering from spinal stenosis. Well, what is spinal stenosis? It's a pinching of the nerves. Similar to the shape of an hourglass, as the spine develops arthritis, there can be pinching of the nerves, and this pinching leads to symptoms that we'll talk about next. Leg pain is a cardinal symptom for spinal stenosis and can be felt as either lightning bolts or cramping in the legs, generally both. Symptoms of leg numbness is very common, especially with standing and walking, where patients can experience numbness in the bottom of their legs, typically from their knees down. Leg weakness, as you spend time standing and walking, is also very common, and people will state that their legs feel like jello or heavy. Lastly, back pain is a common component of lumbar spinal stenosis, and any of these symptoms can be experienced either in isolation or in combination with one another. Well, what makes your symptoms worse? Well, typically standing and walking do. Being up and active tend to bring on the symptoms of spinal stenosis. Whereas doing things like bending forward or sitting down will help alleviate your symptoms, with one of the common reports from patients being they prefer to push a shopping cart when they go to the store because their legs feel better. So what are your options? Well, first, we can do nothing. But typically as a patient, when you get to the point of seeing a spine surgeon, you're looking for options to help with your symptoms and pain control. Starting with things that are not surgery is generally what our initial recommendations will be for patients that have mild and moderate symptoms. And if your symptoms are severe or refractory to any interventions that aren't surgery, well, it's possible that surgery may be discussed. Things that are not surgery include exercise and activity, with the cardinal recommendation being a physiotherapy program to strengthen your core and back muscles in a flexion pattern. Next, we have things that are spinal injections, and those are meant to either improve your symptoms or provide your healthcare provider with some additional information. Lastly, are medications by mouth that are not narcotic or opioids, so medications like Tylenol, Advil, or anti-inflammatories, or some nerve medications may be recommended. If surgery is an option, if spinal stenosis is the problem, then a decompression will be recommended to deal with the pinching of the nerves to create more space in the spinal canal so the nerves no longer are pinched. For some patients, it may be recommended that we do a fusion as well to help stabilize the spine at the time of surgery. So what's next? Well, as your healthcare provider, we're going to consider the symptoms that you have. We're going to look at the imaging that you have and try to correlate those symptoms. And lastly, determine what the impact on your quality of life is so that we can come together and have a plan. That plan may be simple. Do nothing if your symptoms are either non-existent or mild. And chances are we will start with things that are not surgery, either exercise or injections. And lastly, if your symptoms are quite severe or they're not responding to interventions that aren't surgery, well, surgery may be an option. Thank you for taking the time to watch this short video. We've gone through and found some resources that are reliable, and these will be available to you after your appointment